Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and today's topic of infectious medicine is subacute meningitis. This topic of subacute meningitis we will cover in 4 different sections. In the first section, we will talk about the common causative organisms that can cause subacute meningitis. And then we will talk about the initial infection of with these Mycobacterium tuberculosis and also fungal infection. So all that infection with Mycobacterium tuberculosis, fungal infection, and also besides this some other common causative organism we will discuss in the first section. Then in the second section, we will talk about some lab tests which can be performed to diagnose subacute meningitis, and then cryptococcal polysaccharide antigen test. That will be in the second section. In the third section, we will talk about empirical therapy, antimicrobial therapy, and antifungal drugs used for the treatment of subacute meningitis. And in the fourth section, we will talk specifically about the subacute meningitis caused by the syphilis as a result of syphilis, and this is syphilitic meningitis. What are the causes, signs and symptoms, and how we can diagnose and treat this condition known as syphilitic meningitis. So all that we will talk in our today's lecture topic, subacute meningitis, and in this we will try to cover mainly the Mycobacterium tuberculosis causing meningitis, different fungal infections causing meningitis, and also the meningitis associated with syphilis. So keep watching sqadia.com to learn about this topic.